evening and welcome to the Troy Public Library. My name is Connie Doherty and I'm the head of the Adult Information Services Department here at the library. So thank you all for coming tonight, especially braving the wind and the cold and the power outages. We're very happy to have you here. Tonight I would like to welcome Ms. Marjorie Mitchell, the Executive Director of the Michigan Universal Health Access Network and member of the Board of Directors of Michigan Consumers for Healthcare. Ms. Mitchell received her BA from Oberlin College and her master's in special education from the University of Michigan. She spent 30 years as an educator and advocate for persons with developmental disabilities and their families at both the local and state levels. In her professional career, she has acted as director of the Western Wayne Association for Retarded Citizens, supervisor of special education for the Wayne Westland Schools, consultant for the Michigan Department of Special Education, and executive director of the ARC Michigan. Ms. Mitchell also serves on a number of other local, state, and national groups addressing healthcare issues. Since 1990, she has put her energies into gaining affordable, quality healthcare for all. So thank you again for coming, and without further ado, Ms. Marjorie Mitchell.
Thank you. Wait till you hear it. Let's wait till you hear it. I'm really pleased to be here this evening. Let me give you an idea about what tonight's going to be about. I am not a navigator for the Affordable Care Act. I am an educator. What I try to do is to go around and talk to community groups to give them a basic understanding of the Act, give them some specific information about the enrollment process and how the Act may or may not be able to benefit them, and then answer questions as far as the communities are concerned. So every family is different, everybody's needs are different, and so getting into real specifics, I like to drive people to the people who can help them and who have been trained to do that on the real specifics of the Act. Let me start out by saying the Affordable Care Act is not a perfect piece of legislation. Large pieces of legislation like that rarely are. It doesn't cover everyone, which a number of us would have liked to have seen it do. There's a lot more that can be done in the legislation about cost and quality that can be addressed in the future. And every president since Teddy Roosevelt has tried to do something to get more health care for Americans and have failed. This is the best that we could do. Democracy, I love to say, is messy. Whenever you have a huge, complex society like America, and it works on having all of us come together and to try to get consensus about what needs to be done, there's always going to be this tension. And there's going to be compromise. And there's going to be a lot of give and take. And then you get a product, you get experience with that product, and then we all have to be willing to change it as it needs to be. Government of, by, and for the people. If it's not working for the people, then we need to move and improve it. And that's the way I look at this piece of legislation. No piece of legislation in America has ever entered being, Social Security wasn't perfect when it was there. When Social Security came out, women, farmers, lots of folks were included in it. Every year it changed and got a little bit better. The Voting Rights Act came out. Poll taxes, a lot of different things on it got changed from year to year as we had experience and we talked more about what we wanted for those things. And this is no different. It is the best it is what it is, and that's what I'll talk to you about. It is what it is. And as I said, it doesn't do everything. It addresses three main issues that Congress pretty much agreed on. Didn't agree on how to address them necessarily, but they pretty much agreed on the issues. The first issue was cost. And that is that the cost of health care in America is 3 to 5 times more than anywhere else in the world. And many of these countries cover all of their people with health care at a far less cost than America. Economists were telling Congress for quite a long time that we needed to do something about the cost of healthcare. The trajectory of the rising costs was terrible. And they were projecting that we were going to, by the year 2020, be spending so much money on healthcare that it threatened to implode our economy. It would be 20% of our GDP, meaning there'd be not a lot of money left for some other things that we all think need to be done in this country. So they said something has to be done, and Congress pretty well agreed. It was not a good trajectory to have healthcare costs rising so much. And most of you experienced that with your premiums rising, your deductibles rising, your co-pays rising. Everything was going up. The second thing that Congress pretty much agreed on, that in the richest country of the world, it did not seem good that we had 53 million people who were uninsured. That was a little embarrassing. And that we also had millions of others who were struggling to pay their health care costs, either their insurance or to pay for it as they went, because health care was so expensive. I like to tell people I had a cancer operation last year, hospital 2 days. Anybody guess how much it cost?
$100,000.
$34,000 for 2 days. 2 days in the hospital. Without insurance, individuals or families could not afford health care. And health care is not, whenever we talk about, competition, competition in the market should handle this. Healthcare has never operated as a market. A true market is where there is total transparency between the buyer and the seller. There's no transparency, or very little transparency, in our healthcare system. I can't read my bills that I get from my hospital. I often didn't understand or realize what was in my insurance policy. And so the transparency simply was not there in this what people like to call a market. The second thing is markets are really for things that are wants and not needs. Healthcare is a need for all of us. None of us will get out of this world without healthcare. And whenever something is a need, I can't sit and research if I'm in a car accident about which hospital I go to, where I can get the best, thing. I can't always even research anything about the cost of my health care very easily. And I can, if I'm going to buy a car. I can if I want to buy a new mixer or whatever else. It doesn't function as a market in the traditional sense of the word. So we had cost going up, we had bad access, 53 million uninsured, millions and more were ending up in bankruptcy. Healthcare, paying for healthcare became the biggest reason for bankruptcies in America. And this Congress did not think was quite right either. The third thing that Congress pretty much agreed on, disagreed about what to do with it, is that we had allowed our insurance companies in America to have some pretty discriminatory practices regarding sick people. You could be denied health care coverage, insurance coverage with your a pre-existing condition. Somebody raised their hands in an audience a few weeks ago and said they were denied because they had acne when they were young. Which, we can all laugh at that, but it wasn't funny to her at all. Pre-existing conditions, and Congress said that doesn't seem right. Insurance you pay for, and then it pays for your health care. The second thing they didn't think that was okay is that if you had insurance and you got sick, you could sometimes be dropped. The next time you went to enroll, you were told that you were not eligible, that they were not going to cover that year. You had a pre-existing condition, obviously. Very difficult to get insurance. The third practice of insurance companies that they were concerned about was the capping of benefits, either by the year or by your lifetime. So that some policies would be written that, okay, we will cover you for $1 million. But when that $1 million is spent, you're uninsured and you're on your own, or by the year, whatever. So Congress thought that these three things they pretty much agreed on, and that's what they were addressing in this legislation. Not everything in health care, these three things: cost, access, and some discriminatory practices within the insurance company. There are some other things in there that they attempted to do on quality and that, but in major, that's what they were trying to address. So for cost, how did they do that? Well, they targeted, and again, this legislation is targeted at the uninsured and the underinsured. Not everybody. It's targeted at the underinsured and the uninsured. They put an emphasis in the act. We've always been a fix-it as far as health care. You get something, you go in and the doctor or the hospital tries to fix it, and then you're gone again. As Congress talked about health care and as the public health officials, weighed in on it, it was agreed that it would be far more cost effective if we began to turn our healthcare system from a fix-it system to one that tried to prevent disease in the first place, that we spent more money on trying to get people access to healthcare providers and to be able to catch diseases before they got very bad. And let's take diabetes. If you catch diabetes very early and you manage that disease, then we don't have to be cutting off people's arms and legs at future years whenever that disease has progressed the way diabetes progresses. So they wanted to put an emphasis on prevention. And one of the ways that they did that, and all of us, even though this is targeted at the insured and the uninsured, we all got the benefit of this part of the act, and that is they created this list of, I think it's 73 tests that people have that catch chronic disease early and that sort of thing. And they said that we won't charge co-payments for those tests anymore. So that mammograms, PSA tests, diabetes tests, and those sorts of things. No longer, if we don't have people have to reach into their pocket for a copay, they're more likely, if they are in any way having difficulties financially, we're more likely to go and get the test. And so they're trying to encourage people to be a part of their health care. And there is a lot of things in there talking about personal responsibility and trying to have us be better users of health care. For too long, we as Americans have just, okay, the doctor says I need to have a test. I have been told, well, your insurance pays for it, so why won't you have the test? Well, why do I need this test? First, convince me. I tell people, I had a Whipple operation for pancreatic cancer a few years ago. I made my doctor convince me I needed that. It seems really odd now that I did this, but I kept saying, isn't there anything else we can do? Is there anything that's less intrusive that we can do? What happens if I put this off? And it wasn't until he told me, well, you'll die, that I thought, oh, maybe I better have this operation. But we need to question the amount of health care we have. We have, in America, more tests than anywhere else in the world. We take more pills than anywhere else in the world. Some of these pills are not very good for us. Some of these tests are not very good for us. We need to get back in that more is not always better in healthcare. We need to take personal responsibility to say, what is best for me? Why do I need this? What's it going to do to me? Rather than just doing things because someone tells us to. So that's another way for saving costs, is to coordinate our care, to start really working on educating ourselves about health care and the cost of health care, and having all of us take some responsibility for getting value for dollars in health care. So coordinating care, medical homes. We're really working to get people medical homes. Electronic health records so that doctors can see what each other is doing, so that we don't have people going to lots of different doctors and having the same test a couple of times. I had an aunt and uncle who were older, and every time they went to their primary doctor, they usually had to go to a specialist after that. They go to the specialist would all take the same blood, do the same stuff. They weren't communicating and sharing the information. That's expensive whenever we are duplicating all of that stuff. We even had a family experience where a doctor prescribed a medication. Unfortunately, my family member didn't have their list of medications with them, couldn't remember all of them, drug interaction, ended up in the hospital. Those kinds of things we should be able to prevent if we communicate well and if we're all asking questions and take some responsibility for our health care. Another thing that the Act does to somewhat save money, and it does, but it's another regulation on the insurance companies. And prior to the Affordable Care Act, there was no top thing about how much of a premium dollar needed to be spent on actual health care for the policyholders. And we had some providers, insurance companies here in Michigan, who were spending only about 60 cents of every premium dollar on health care. The rest of it was for, profits, marketing, God knows whatever else, even though most of these were nonprofits. So the Affordable Care Act, with the experience of the Medicare and the Medicaid programs, which have very low administrative rates, like 3% and 3.8% or something like that, they said, insurance companies, you must spend for the individual and small group market 80 cents of every premium dollar on that person's health care. You can have then that other 20 cents, for your administrative needs. And for large groups, it's 85 cents on every dollar. So that is good. And if you don't, insurance companies, we're going to be looking at your documentation every year, then you must send that money back to your policyholders. And in fact, in Michigan, we have a number of people who have gotten checks from insurance companies who were spending more than the 20% over the last couple of years. So that is another way of trying to hold down and to try to see that money is spent on where it's supposed to spend. You are paying for health care. You are not paying for a new building for some company or something. You're paying for health care. How can we get more health care out of our health care dollar? The last thing in the cost is that in order to drive costs down, you need large risk pools for people. You need to have lots of people in the pool. And insurance companies a lot of the time had small pools that they kind of worked to do, higher premiums in those little pools, and then they'd end those and go to another one. What the Affordable Care Act tries to get as many people possible and to share the risk of health care across as big a pool as possible. Now, in order for it to work for insurance companies, it was not the president or Congress that did the individual mandate. It was the insurance companies, and I can understand this. They came to Congress and said, okay, you want us not to discriminate against sick people. Well, we can't take just sick people if you don't guarantee us that you are going to bring us healthy people into this large risk pool also. Because our business plan doesn't work by just bringing in sick people. We need to have healthy people also in our risk pool. So that's what became the mandate. It was really something that insurance companies said, if you don't want us to fight you on this, then you need to make us a business plan where we get lots of healthy people and young people paying so that we can afford to share the risk with everyone. So that's how some of the ways that they dealt with the cost issue within the Act. And over time, it is hoped that all of these things, and it is beginning to drive healthcare costs down. I can't remember the last data that I read, but healthcare costs are going down. They are growing at the smallest rate they have in decades right now. And we've only had the Act since 2010. How did they deal with access? And that's what we're going to spend a lot of time on tonight. And that is that there are two ways. The expansion of the Medicaid program, which is the state federal program for poor people. And then the other aspect of it is to develop a marketplace where insurance companies would sell products with a prescribed set of benefits, and that people and families, individuals and families, could come to this market and they would be able to, depending upon their income and their household size, be able to get financial help with premiums. And then in some cases, also with deductibles and copays, and we'll go into that. So those are the two ways. And again, the marketplace is focused on the uninsured and the underinsured. So that if you are insured, if you're on Medicare, you cannot use the marketplace. If you have veterans insurance, you cannot use the marketplace. If you are employed by an employer whose policy is not costing you more than 9.5% of your income, which is, we'll be talking about all this more, and has a benefit package that meets the requirement of all the policies on the exchange, then you can't come to the marketplace. This is for people who have insurance policies that are expensive, have few benefits, and that they would be able to come to the marketplace. And we'll talk about that a little bit more. One of the other things for access is that most of you probably know, if you have children under the age of 26, that the Act allowed families to keep their children on their policies up until the age of 26. So that is access, and we're going to spend a lot of time on that. Then the discriminatory practices of insurance companies. In 2010, insurance companies were no longer able to discriminate against sick children. In January of next year, they can't discriminate against anyone who is ill. We all are going to be able to get insurance policies. In 2010, it was illegal for them to drop people who got sick. So that stopped in 2010. And in 2014, capping the dollar value of insurance policies becomes illegal, both for annual and lifetime benefits. So now here we are in 2013, when we are supposed to be enrolling in the Affordable Care Act, the people who are uninsured and underinsured. And as you know, we had a pretty rocky rollout for the whole thing. I'm not surprised. My husband did the worldwide communications for Ford Motor Company, and I know every time he rolled out anything, no matter how hard he tried to test it, it was always a rocky ride for a few months, and calls in the middle of the night saying, my computer's down and I want it started right away. Well, we'll see what we can do. But I'm not surprised. It is worse than I thought it was going to be. I will certainly admit that, but I'm not surprised. So hopefully when we are done tonight, people will calm down. I hear today that people were actually able to go through the whole process today with no problem. So I'm hoping that we're on the mend as far as all of that is concerned. So let's start with enrolling now in the marketplace. Well, good, Margie, I already did that. There are 4 ways that you can enroll in the marketplace, and to get Medicaid, CHIP, which is the Medicaid program for children, or to access insurance products on the exchange, you have to go through the marketplace. So there are several ways. One way is to utilize a navigator or a certified community assistant. A navigator is trained for 20 hours online and passes a test. And I'll show you how to identify navigators in this community at the end. A certified assister has 5 hours of online training and takes a test. And these are people who are available for you to ask questions specific to your family that as you try to navigate and fill out the application. The second way is there is a toll-free number at CMS at the federal level that you can call, and they can help walk you through the application process at your computer at home. You can just use your computer at home if you're really savvy and all of that. I talked to a man the other day who really did think it was like TurboTax. You answer one screen of questions, and depending upon how you answer it, another screen comes up, and you move along that way. And then the last way is, of course, you can download the paper copy, fill it out, and mail it in. What we were doing in the first weeks of the opening after October 1st was a lot of the navigators were downloading hard copies, filling them out, and then calling the information in. It was a little cumbersome, but we were getting people enrolled. Your application goes to the IRS. Why the IRS? The IRS, because it is the federal agency that has the information on income and household size for Americans. And that is what is the eligibility. Is based on income and your household size. So the IRS already has that information. So that's the agency that verifies the information that you fill out in your application relative to income and household size. And then, hopefully in real time, soon, you would get something back from them that would say, dear so-and-so, you're either not eligible or you are eligible, and it will tell you what you are eligible for, Medicaid, or you are eligible for a premium tax credit of this size, and then you would then be going back to your state marketplace to look at insurance policies that would be available through your state and make a decision about your insurance policy, and we will talk about that process. The knock on the door to the marketplace is healthcare.gov. If you are going to apply, there is information that you need to have readily available with you. You need your Social Security number. Legal immigrants are eligible immediately to go on to the marketplace for insurance policies. They still have to wait 5 years for Medicaid. But legal immigrants can purchase insurance on the marketplace. You need your income information, pay stubs, W-2 forms, whatever, so that you have that information to fill in. If you have a policy, anyone in your family already has insurance, you would need to have the numbers of those insurance policies. Now, there are two ways that if you are employed, you can go to the marketplace and see if you can get a better deal for coverage. And those two ways, again, are if your employer's policy is costing you more than 9.5% of your income, or your employee's policy does not cover the essential benefits that are required on the exchange. So those are the two ways that you go in. If you do that, your employer has to fill out an employer coverage tool. If that is confirmed by the IRS, then you can go to the marketplace and your employer gets a penalty of $2,000 because they would no longer be covering you. Because this is a piece of legislation that has the concept that we all need to put some money into this. Now, this was a funded piece of legislation. At the time it was passed, Congress would not allow any piece of legislation to pass if it was going to add to the debt. It had to be funded. And this is funded in several ways. A lot of the money is coming from the provider areas themselves, insurance companies, pharmaceutical companies, hospitals, and whatever. They all are paying a fee that goes into the pot of money that is helping to pay for the premium tax credits and all of in the Medicaid program. They are all putting money in because they are getting lots of people coming to them now who they can charge for their services. So they agreed to that before the legislation was passed. There is two people over $250,000 pay more in the way of taxes. There was also a large amount of money that came out of the Medicare program, not out of benefits. Scared older people, I can't tell you how scared when I first started doing it. Older people were, are my benefits going to go down? No. The money that came out of the Medicare budget came out of the administrative fee that insurance companies were getting for the Advantage plans for seniors. And an Advantage plan for seniors is one that takes your Medicare and your supplemental policy and turns it into one card. My family has a Advantage plan. And when law was passed a few years ago, insurance companies thought it was going to be really expensive for them to administer that. So they got a big boost in an administrative fee. I forget how much it was, 28% or something. Well, as the government looked at the experience of that program over years, they came back and they said, you aren't using that much money on administrative costs. So they took that amount of money and put it back into the Medicare Trust Fund to help fund the things that seniors got out of this act. Lowering the donut hole, a wellness visit, no out-of-pockets for their preventive tests and that sort of thing. So yeah, that was a piece of money too. And there are some other smaller amounts, but it all adds up to the fact that the Budget Office thought that this, with the prevention things that are going in it and driving costs down, that over 20 years it would save billions of dollars to our debt. It wouldn't add to our debt, it would help our debt. So that's the application information. So again, both household income and size are eligibility requirements. Household size is different from Medicaid and for the marketplace, but you don't have to worry about that. There are calculators on all the websites that you can figure things out very easily when you put your personal information in, before you even go on the website to actually apply. This is why household size matters. 100% of the federal poverty level is the least that you can make and still go on the marketplace. And that really applies to states that do not expand their Medicaid program, although it may well apply in Michigan until we get our Medicaid program going in April. We'll talk about that also. 133% of poverty, and it really goes up to 138 because they use modified adjusted gross income. So it's about it's a few $100s more for that. But that's the maximum you can make and still qualify for a Medicaid program. 250% of poverty is the maximum you can make and still qualify not only for a premium tax credit, but also for help in cost sharing, your deductibles, your copays. And I will show you what that help is like later. 400% of poverty is the maximum that you can make and still get help in a premium tax credit. That's the maximum you can make. Now, anyone can purchase those policies on the exchange, but you would have to pay for the full policy premium yourself if you were over these income levels. Okay? Looking to see. This is how much you might expect to pay out of your pocket for your premium at different income levels. And this is for a household of one. It just gives you an idea. Again, every family's different. There are calculators that will figure things out. I just am trying to give people an idea of how this whole thing works. The amount of premium tax credit goes anywhere from, well, in Michigan, it'll be from 3 to 4% up to 9.5%. 9.5% is the maximum you would ever have to pay for those income levels for an insurance policy. The dollar amounts are annual, so you divide that by 12 to see what a monthly income would be, or a monthly payment would be out of your pocket for your share of your insurance policy. So 3 to 9.5% of income is the range for the premium tax credit. Eligibility. Expansion of Medicaid is U.S. citizen, legal immigrant for 5 years, income under 133% of poverty, 15.2 for an individual, 31.5 for a family. We were to begin October 1st, except for 2 reasons in Michigan. And the 2 reasons were, most of you probably know that the Medicaid expansion program was optional for states. When the act got legally challenged and went to the Supreme Court, and the Supreme Court said, yes, it's legal, they also said that the Medicaid program could be optional for states, despite the fact that the federal government is paying 100% of the program in the first 3 years and 90% of the program in years thereafter. States were required to pass legislation to accept that money from the federal government. Michigan didn't get their legislation passed until September 23rd of this year. This is October 1. So we were hoping to enroll. And in that legislation, they didn't put 2 words, effective immediately. Therefore, under Michigan law, it cannot take effect until 90 days after the close of the current legislative session, which ends in December. Hence, the earliest we can expand our Medicaid program is April 1. The second reason that it is delayed is that in that legislation, they put some new cost-sharing legislation for people who are on Medicaid. And I want to remind you that people cannot be dropped from Medicaid if they cannot afford co-pays and deductibles. You can't be dropped from it. So, at any rate, both of these things required a federal waiver in order for us to be able to do it. That waiver went into the federal government a week ago Friday. I've seen the waiver. Actually, the waiver does everything possible to not make it onerous for the Medicaid population and still keep with the what the legislature had in mind. They also, if it stands and is approved by the federal government, Michigan's Medicaid program would include adult dental, adult vision, and adult hearing, which will be a wonderful improvement. We tried so hard to get that onto the exchange, the insurance exchange. But that's something we can still work on in coming years. So those are the 2 reasons why we won't be doing anything on Medicaid until April 1. All right. Insurance marketplace. Eligibility, U.S. citizen, legal immigrant, income between 134 and 400% of poverty. Enrollment sort of began in October 1. That's not coverage. Enrollment ends March 31st. So they made it a 6-month enrollment span for this new program. So we still have time. Now, if people get signed up by December 15th, their coverage will begin January 1. If they don't get signed up until March 31st or any time after that, it's probably going to take several weeks before they actually get their coverage started. I don't think it will be 3 months. It shouldn't be, but at any rate, that's the way that is going. Afterwards, you can change on the exchange, you can change insurance policies every year. You don't have to stay with one. So that every year there will be open enrollment, and it will be the same as for the Medicare program. People on Medicare know that October 15th to December 7th, that's right, is open enrollment. It'll be the same open enrollment period as Medicare in future years. These are the 10 essential healthcare benefits in marketplace insurance policies. We were really pleased to get mental health and substance abuse included into it, habilitative services, psychotherapy. We got some things in there that have not been covered well by out of marketplace insurance policies over the years. So we were really pleased about that. We got pediatric dental and vision in policy, but we did not get adults covered for that in this first round. Congress just did not want to make it to add those, even though they are some of the least expensive things to add to a policy. We couldn't get them. And so it is a fairly rich package. We're pleased with it for the most part. So again, 2 types of subsidies in the marketplace. Premium tax credits to help pay for the monthly premium, and cost-sharing reductions to decrease out-of-pocket expenses like deductibles and copays, and they can only be applied again to people at 250% of poverty. Premium tax credits are assisted with coverage. That begins January 1. Deductibles, most people know a deductible is what you pay before the plan kicks in for most benefits, set on a yearly basis. Co-payments are the items, the amount of money you take out of your pocket at your site of service. Co-insurance is the same as a co-payment expressed in a percentage. This is how the cost sharing will work. Everything is based, the premium tax credits and cost sharing are all based on a silver plan. Insurance policies within the marketplace, and that is another slide that's coming up, are based in bronze levels, silver levels, gold levels, and platinum levels. And they all relate to actuarial value. So that bronze will have an actuarial value of 60%, which means your policy covers 60%, you cover 40%, very low premiums. Platinum is up at the top. Its actual value is 90-10. Your plan will pay for 90% of any of your health care. You will pay for 10, but they're much higher premiums. So we'll talk about that. And the silver, of course, is a 70-30 actuarial value. So that silver policy, for the most part, has a deductible of $2,000, maximum out-of-pocket of $5,500, and all of the maximum out-of-pockets mean that if you reach that in a year's time, you're done. Your policy pays for everything else. That's the maximum you would be taking out of your pocket. $1,500 for admission, you can say $5,500 is several trips to the hospital kind of thing per admission. Office visits of $30. The people who get the most help are the people who need it the most. So that up to 150% of poverty, the actuarial value goes up to 94%, with the family or the individual paying 6%. No deductible, maximum out of pocket of $1,000, $100 per admission, $10 visits. And then as you go up to 250, it gets pretty close to what the silver plan offers. And this is what we were just talking about. This is the way they are tiered on the exchange. So that every insurance company, most of them offer policies in all of these levels. They may not offer all of them, but most of them do in the bronze, silver, gold, and platinum. Another way of looking at it is low premium, high deductibles and copays, high premium, low deductibles and copays, going up the hierarchy of metals. So how do you get your premium tax credit? You fill out your application, they tell you what you get. Once you make your decision of the insurance policy that you want for you and your family, you notify the marketplace and they send your credit directly to the insurance company. The insurance company then contacts you about your portion of what you are going to owe them, and we'll find out how you want it to be billed, monthly, quarterly, or what. You need to get your first check into them before they will start your coverage. If they don't get that check from you within 3 months, they'll drop you from the policy and return the premium tax credit. And you can, if you can afford it, prepay your premium tax credit to the insurance company and get it back as a tax refund the following year. I don't think a lot of people are going to do that. There are 2 reasons that an insurance company can pay you more than the silver plan. And that is that if for tobacco use and age, they can charge up to 50% more for tobacco use and up to a variation of 3. Most are not going that far, but they are allowed under the law for older people to charge more. And again, you have to, it's pegged to the silver plan. I only put this in just because, again, who you claim as a dependent on your taxes determines your household sizes. And people need to make sure that they know who can be a dependent. You all probably know this, that children doesn't have to be your biological child. It could be any of those nieces, nephews, whatever. As long as they are a U.S. citizen, they live with you for more than half a year, under the age of 19 or 24 if they're a student, and the child doesn't provide more than half of its support. Doesn't have to be a child to be a dependent. It can be a relative, it could be just someone who isn't related to you at all but lives with you. If they are a U.S. citizen, provide more than 50% of their support, be related to you or live full-time with you, and that person makes less than $3,900 a year. Key takeaways. Households for premium tax credits and Medicaid are not necessarily, we all think, well, we'll just get one insurance card for our whole family. Everyone in a household will be covered by insurance, but it could be that the child, depending upon who lives together, we have a lot of families where the people are not married, but they consider themselves a family. One person takes the child as a dependent on their income tax. They file separately and all of that. So it is possible that under one roof there could be different insurance cards. Somebody could get insurance from an employer, but the employer does not cover the spouse or the kids. So, there will be different ways. Hopefully everyone is insured, but it doesn't have to be all with one policy or whatever. And I remind people that it's our responsibility to inform the Marketplace Exchange for any significant changes in our household size or our income. Premium tax credits are the only thing in the Act that are reconciled annually. And that means if, for example, you have a very high you qualify for a really high premium tax credit, you're at the very top, and you're unemployed, you get a really good job. Now you no longer qualify for that premium tax credit. So don't get any surprises the next time you file your taxes. Notify them, and you can get things straightened out immediately so that you don't have to pay back a bunch of money. Conversely, if you have a job and you lose it, notify the exchange, and you would, get a higher premium tax credit immediately. If someone dies, if you get married, all of the things that change your household size or your income, within 30 days, you need to notify, the exchange and your insurance company. These are the insurance companies who are on Michigan's exchange. Everyone thought in the beginning that insurance companies will never do this. They'll never be a part of this. Well, across the country, we have had really very good response of insurance companies as far as being a part of all of this. We had 13 or 14 who came in Michigan. Now, I like people to just know what the co-op is. Have any of you heard of Michigan's co-op insurance company? As part of the Affordable Care Act, a lot of people really tried hard to get a public auction like a Medicare program as one of the options on a state exchange, and that Congress was not interested in that at all. So what they did was they put together a pot of money and they made it available to states to develop an insurance company, and this is an insurance company. And they would help with just the startup funds. It must be sustainable on their own. It isn't sustainable by the Affordable Care Act as a co-op. And I think of it as a credit union is to a bank, a co-op insurance company is to an insurance company. The co-op must have 50% of its board of directors consumers, and it must be dedicated to they get their 20% administrative fee, but, they don't make money beyond that. They pour the money back into keeping premiums low and benefits as rich as they can be. Now, unfortunately, our co-op didn't have any actuarial experience and came in a little heavier on the premium this year than the other insurance companies. And if they make it, I'd like to see them make it, because what we found is that in states where they applied and developed a co-op, their insurance costs on the exchange are significantly lower than in states where there isn't a co-op. They are a real driver for competition for insurance companies. So we'll have to see how it goes. I don't know whether they're going to deliver good products and have good service or anything else. I just want people to understand what it is, because it's not anything. We've all heard of Blue Cross. Most of us have heard of Priority Health and Molina and all of the others, but very few people have ever heard of Consumers Mutual Insurance of Michigan, and that is our co-op. So I'd like people to remember to not go into the exchange and just think I'm going to choose an insurance policy the most they think about it, because even in the benefit package, there's the minimal benefits that are in there, but some insurance companies are making them a little richer in order to get your business, which makes sense. So there are a few products on our exchange that offer adult dental. There are a few products that have very small networks, that there aren't very many doctors in it, so if you have to go to very many specialists, you could be paying a lot more. So if you have a doctor you like, you need to make sure and call your doctor and see if they are a part of the insurance network that you are choosing. If you need to take a look at the size of the networks to make sure that if you have a lot of health needs, that they have all the kinds of specialists that you need. You need to look at your budget and you need to look at the health of your family. Do we have a really healthy family? Since you can use your premium tax credit anywhere on that list of metal options, do you want to use it to buy a bronze policy, which has a lower premium, and your credit, if you have a really high credit, could pay for all that premium? Do you want to do that and have high deductibles and copays, but you don't use it that much, so you may do an annual physical or run in a couple times? That may be good for you and your family. If you have a family with a lot of health issues and prescriptions and all of that sort of thing, you want to use your credit for a gold policy. And you need to take a look at that, and the benefits and all of that sort of thing, because the difference between the premium of the silver and the gold, you might eat up in deductibles and copays very, very quickly. So, you just need to think about it. And then remember, next year I can change if I didn't do it right. Open enrollment begins October 1. So that by the next January you could choose something else. But people need to think about this, and we haven't. A lot of people who've never had insurance aren't quite sure how to go about it. Now, again, everyone is required to have minimal essential coverage. Now it isn't January, it is March 31st of 2014. Everyone will be required to have insurance or to pay a penalty. And this is what the penalties look like. For each adult, $95 or 1% of their income, whichever is larger. And for each child, you add on $47.50. Next year, it's $325, adding on $162.50 per child. 2016, $695, $347.50 for each child, or 2% and 2.5% of your income. So that is the penalty structure for individuals and families. Now, again, filing thresholds because anyone who doesn't file income tax, they make too little money to do that, doesn't have to pay a penalty. And that's the filing. Single, $10,000. Head of household, $1,280. Married, filing jointly, $20,000. So that gives you the penalties. These are the exemptions for the penalty. Religious conscience, hardship, financial hardship means that you can't find a policy that you can afford. If your state does not expand Medicaid, you don't have to pay. Your income would be low enough that you wouldn't have to pay. Unaffordability of insurance, more than 9.5% of your income. So those are the things. Indian tribe membership, somebody in jail doesn't have to pay the penalty. I'm still not sure what healthcare sharing ministry is. I have got to look that up. So there are ways that people can be exempt from the penalty. This is where in your county, if you look, this is a lot of Wayne County information, but down here, if you want to find a navigator in your area, you go to enrollmichigan.com and you'll come upon a picture of the state of Michigan divided into regions. You look for the region where your county is. I believe Oakland County is Region 9. You scroll down and find Region 9 and you'll find a list of telephone numbers of people who are trained as navigators. The lead navigator agency in Oakland County is Jewish Family Services. So you would be able to find them there. I want you to know that there's a lot of scams going on out there right now as we get this going. I've turned a couple into the Attorney General already. I wish I didn't have to, but there are people out there who are calling people and say, hey, send me $25 and I will get you the best Obamacare policy. Then you don't have to mess around going online or anything. For $25, I'll do all that work for you. No. Navigators do not charge money at all. They are prohibited to, and navigators cannot steer people to specific policies. All they can do is help people to understand the process, answer their questions about what the application process is, but they cannot steer to products and they cannot accept money. And we have a number of scams going on that are steering people to specific insurance products. And if they're trying to steer you to a specific product, you may want to think about that before you take it up. So be aware of scams. My organization has this phone number now that, we will take information, and if we think that it needs to be investigated, we know that a lot of people will never call the insurance commissioner or call the Attorney General's office, and we have relationships with both of those groups, and so we can just call and say, hey, have you heard of this? Or, I get things, someone sent me something the other day that they'd gotten in the mail that was kind of dodgy, and you just let people know, because people are out there to take advantage of people, because this is so new, and beware, buyer beware, I guess, is what I am saying. And I haven't talked about the SHOP exchange, which isn't starting for a while. There are, for small businesses, also the ability to get premium tax credits. If they have above 50 employees, they can get help. But that's a whole other talk. But if anybody wants to know about that sort of thing, well, I can talk to you afterwards. Or if you look under small business in this little booklet that my organization put out, it's meant to give an overview of the thing. And it also, for seniors, you can go to page 10 and see what seniors got out of the act. And it for different populations, it talks about how the act is, what benefits the act has for them. So that is my talk. Now, it's your time. Yes?
My neighbor asked me to ask you this question. Her 16-year-old is on Medicaid right now. She said, look, they want to buy the whole family want to buy the insurance. What do they have to do? They have to cancel this and start all over? Or?
A 16-year-old on Medicaid.
And the rest of the family, they don't have insurance.
They don't have insurance.
Now because of this, they have to,
Well,
apply.
they could. And if they find a family policy that meets it, yes, then they could transition off the Medicaid program into that policy.
So they have to cancel it.
Well, it would automatically do that for you. If you go in and you do one and you say, this child is on Medicaid, and they'll tell you what to do. So that, yeah, I think they would probably want the whole family on the same policy under that circumstance. But It may not. It may be that the whole family is on Medicaid. I don't know. They'll tell them what they, when you fill in the application, it will tell you what to do.
And this question for me, when do you get subsidy from the government? When do you get that?
What you get it can begin January 1. Oh, when do you get the subsidy? Thank you. Sorry, Sandy, I knew that too. I'm the one who said, I should always repeat the question. The subsidies will go to the insurer prior to January 1, and services start January 1 if you have your application in by December 15th. So that any time after the application is complete, you have chosen your insurance company, they will send that to the insurance company. So it'll be different for different people. But if you get yours in by December 15th, the subsidy goes to the insurance company and services start January 1 if you pay the first check before January 1.
That's the tax credit?
That's a tax credit.
Now, I've already signed up for insurance just recently, and she gave me a quote, but I don't understand how the tax credit works. She said.
You must not have, did you go through the exchange? She said she's already signed up for a policy, but she doesn't understand how the subsidy works. Did you go through healthcare.gov?
Well, yes, and then I got Blue Cross, and I
So
started.
you went through healthcare.gov and you haven't been notified yet about how much you are going to owe and how much you're.
No, I talked to someone at Blue Cross.
My feeling is that you either go back to Blue Cross or you call a navigator, you see. And by the way, that if you choose early and change your mind, as long as the open enrollment period is open, you can change your mind about policies. So that you look at it and you say, oh, now I didn't realize that, or something like that. You can change policies up until the closure of the open enrollment period on March 31st. So I would ask someone that.
Well, she told me that that included the tax credit.
Well, then she went on healthcare.gov to find out for her policy what it is. What I tell people when they are going to insurance companies that they know to be able to do it, take a look at healthcare.gov and all of the policies. There may or may not be a better deal for you. Insurance companies are out there, that's their business, and I understand that they're trying to get as many people to take their policies as possible. But as a consumer, you need to look at all the available possibilities. So if you didn't look at all the available possibilities, you may want to do that, or sit down with her and say, I want to look at everything, you know?
I want to just chime in a little bit. I'm a health insurance broker,
Mm-hmm.
so I represent many different companies.
That's right.
That are represented on the exchange there,
Mm-hmm.
and I've actually helped people to evaluate, and I can legally advise them on the different benefits of different companies.
Mm-hmm.
And so we weigh out the differences, and I listen, and then I can come up with an estimate, and I always say an estimate of what the tax credit might be
Mm-hmm.
and how that would apply.
And you don't know until you go to healthcare.gov.
That's right.
That's right.
Yeah.
And people can do it. I mean, I have worked with really good brokers who understand that they shouldn't be totally steering. They need to make sure that people have good information about what their options are. And I don't have any problem at all when that happens. What I have a problem with people who don't do that and steer you to a couple of problems. There was some folks from Florida who came into Michigan and were steering towards the two lowest cost policies of Blue Cross and Humana, and saying it was free health care. Well, the families didn't know whether that was the best policy for them or not. Free health care, well, there isn't free health care. Most everything has deductibles and copays and that sort of thing. So it was very deceptive advertising. We also have some folks who are using the Obama logo, acting as if they are agent, that they are an enrollment team that is part of the government in some way, and they are not. Again, steering people to specific products. So buyer beware. You know, we'll get through this together and we'll make things better in the future. But, you know, I just want people to do a little homework on this and then use healthcare wisely. You know, I am big on the thing that if we're going to drive down costs, we need consumers who use healthcare wisely.
Okay, you mentioned if you're on Medicare, you're not eligible for Marketplace,
Mm-hmm.
okay? Okay, and so my wife and I are on Medicare, so we're not eligible for
No.
Marketplace.
You can't.
No, we have a 27-year-old son at home who's not working.
He is. Do you take him as a dependent? But
No,
he clearly, this is exactly the kind of person that this law was designed to help.
okay, no. So do you use a family income for him, or can he use zero because he has no income?
If you don't take him as a dependent, it's him. It's his income. That's right.
And if you take him as dependent, then it's family?
Then it's family income.
Okay.
Yeah.
One thing you mentioned I think is incorrect. You mentioned
Could be.
that if a child is under 26, you can keep by your policy.
Mm-hmm.
Well, that's only if you have a group policy. If you have an individual policy, that's not true.
Individual policies,
Yeah, you're right.
you cannot if it's an individual policy?
No, you said it right.
Yeah, no, you can.
You said it right.
The
Now,
insurance
my
company,
insurance company, Blue Cross, says you cannot.
Well, that's because he's on Medicare, and Medicare,
Okay.
you can't have a family member under 26 on a Medicare.
on a Medicare,
No,
okay.
he's not no, he has a separate policy. He's not covered by Medicare. He has a separate policy,
Okay.
okay? But when I asked him if I could take him, the answer is no, I can't.
No, you can't take him if you're Medicare, that's
Yeah.
correct.
Right.
And there is another group that if a retirement plan, and people are not on Medicaid yet, but they retired early, and the policy said employee only, those have not yet been transitioned into accepting 26-year-old either. I think that's going to happen, but that was another small group that I became aware of. But it's because you're on Medicare that you could not keep him.
No, this healthcare.gov, is that a Michigan thing?
No,
Is that national?
what is it, what is,
That's
no, healthcare.gov comes out of the federal CMS, HHS, Health and Human
I tried to
Services.
use it a month ago and I could never.
No.
get
Yeah, I'm telling you, today it's better. I've had several people tell me today that they had no problem getting through.
Okay.
So keep trying.
Well, I
Because
got
I'm-
through to it, but I could never get the comparisons.
No, it's because the communication between our state computer and that computer. The states that are having the most luck in getting in early in October were those states that developed their own state exchange. Michigan legislature decided they didn't want to develop a state exchange, and so therefore we have a state-federal partnership exchange, and getting our computers under those circumstances communicating has been very, very difficult. But I heard today it's a lot better. I have told people many times, don't drive yourself crazy. If you aren't getting in, don't spend hours and hours on it. They're going to fix it. You have till till December 15th to get coverage January 1, and you have till March 31st to
So,
get coverage.
with the exception, my son's policy is being dropped at the end of the year. So
Then
they have no insurance as of
He
January
should, he
1st.
should be able to get on a lot better now. Have him try again.
Okay.
Yeah, I talked to some navigators today, and they said, with great glee, I got through today. I was able to enroll people online with no problem. So try it now, and if you don't have luck today, then wait a week and try to get, it's getting better all the time. You still have 2 or 3 weeks till December 15th. You ought to be able to do it.
Okay, thank you.
Victor, you mentioned that people on Medicare cannot use the marketplace. However, did you want to describe some of the provisions of the new law that provide some good news for people
Sure,
on Medicare?
sure. The things that we seniors got, because I am one of them, got is, how many of the seniors here know about the donut hole? Yeah, my husband goes into the donut hole I mean, we go into the donut hole every year because of my husband's asthma, and one of his medications is $700 a month. So that adds up pretty quickly. The donut hole, when we did Medicare Part D, which is the prescription drug portion of the Medicare program, when we did that, there was great consternation in Congress about how to make it so that the country could afford it on Medicare. And so the way they came up with, they set a pocket of money that would be for this expanded Medicare program, and the only way they could make the numbers come out was this, that until it's about $2,000 or a little more, yeah, $2,850. So that seniors would on their drugs, they would when they got to $2,850, it used to be an 80-20, the traditional Medicare copayment actuarially is 80-20. When you got up that you had spent $2,850 on in prescriptions, then you fell into a donut hole and you had to pay all of your prescriptions yourself. Medicare no longer put any money into your prescriptions. And that's where we heard about seniors cutting their pills in half or not buying food or whatever else because they were paying for the entire prescription price themselves. Then they get up to what, 4,000? 47. I've forgotten those numbers. $4,750. When you got up to there, then you got help again. But the people in that middle part were really bad. Well, what the Affordable Care Act does is it shrinks that donut hole every year. So that I have a friend whose mother is already saving $2,000 a year in prescription costs because of the shrinkage of this. By the year 2020, it will be back to the 80-20 Medicare cost sharing thing. So it's getting smaller every year, but it's still there. So that's one of the things the Act does. The Act allows seniors to get an annual wellness visit, where it's not your physical, it is an annual wellness visit, where you can go in and discuss with the doctor about your life. If you live in a 2-story home and you're getting shaky on the steps, you can talk to your doctor about what, and he can help get you to places to get you help. If you're having trouble with your pills, not remembering or whatever else, you just talk to the doctor about a lot of things, or about stopping smoking, losing weight. It is time that doctors in the past, with their trying to get people through, the more people I see, the more money I make, that doctors now get paid for an actual visit to be spent only talking to you about things that may be concerning you about your health and your life at this point and how that affects you. So that's a wellness visit. Again, you got the benefit of the preventive test with no out-of-pocket copayment.
Is that once a year?
Once a year. Annual wellness visit. It expands community services for those needing help to stay in their home. Again, one of the ways the Act wants to save money is to keep people from going into expensive nursing homes and really working to keep them in their homes when that's what they want to do, so there's more in-home dollars for in-home help. It extends the viability of the Medicare Trust Fund for an additional 9 years with all of these savings that are coming, so that it gets extended to the year 2026. So the other things that the doctor can talk to you about in the wellness visit, or at least I would hope we would talk to our doctors about. They're so scared after everybody thought that this was going to be kill granny, that seniors are not doing that. But I really believe in advance directives. My mom died at 96 with 7 kids. Now, if we had not talked to her and all of us, and she had not talked to all of us and showed us her advance directive about how she wanted to die and what she wanted done, with 7 kids, we could have been 3 of us wanting this and 3 of us wanting that. We all knew what my mom wanted, and she had been a nurse. She wanted not to be kept alive with any machines. She wanted to die in her home if it was all possible, well, her apartment if it was all possible, which was a mile from me. And we all knew what she wanted, and there was never any controversy. My mom just kind of slipped away from us with all of us around her and no controversy at all. So I really urge all of us to think about that and to talk to our families. It is hard to talk about, but the fact is, we're not going to live forever. Our bodies weren't meant to live forever. And let's do something good for our children and our families by helping them to know what we want rather than having them guess what we want, and one person guessing one way and one person, and bringing stress into that time when families don't need any more stress with death. Yes.
Now I'm confused, do you have until December to sign up or? until
December
March?
to sign up for services to begin in January.
Uh-huh.
The open enrollment is March 31st, and then your services would begin somewhere after that, whenever you chose your policy, the money got to your insurance company, and you paid your, however long that takes.
But you could wait until March of
Yes.
next year to sign up without a penalty?
Without a penalty,
Okay.
correct.
But you can sign up in February, let's say.
Oh, you can sign up anytime until March 31st. Yes.
Now, do you recommend, if I have limited, fixed benefits in my insurance, do you recommend staying with it, just expand it, or just cancel it and start a different company?
That's totally up to you. If your benefit package is, again, it depends on whether you think it's an expensive, it's a lot of money to pay for what you get, or
Should I
what.
apply for Medicaid first, like this, just to see if we qualify?
You should fill out the application and see what you are eligible for.
And that's on their website there.
Healthcare.gov. And if you need a navigator, go to Jewish Family Services and ask to make an appointment with a navigator. Yes, ma'am.
My son's current health policy is dropped at the end of this year.
Mm-hmm.
Now, one of the things that you needed to have for healthcare.gov was the policy number for the current health insurance. Would you put down that policy?
That's right,
number
and
that-
they would either say this is more than 9.5% of your income, or this policy does not have the benefit coverage that we offer on the exchange, and therefore you are eligible to go to the exchange. Okay? Yes?
Actually, I called the navigator of Blue Cross Blue Shield, but after they asked my income, and they said my income actually cannot meet some kind of tax deduction. So actually they recommend to contact some
Yeah.
kind of government office, and they could provide some kind of government assistance like this kind of. But actually, because actually I want to depend on myself. I don't want to depend on the government's help. So it is very ironical, because it seems that because I don't have so much income, so I need to get the help from the government. So is there any kind of ways, I pay some money and maybe get some deduction, maybe get some deduction from the government, so I can also take the responsibility on myself.
Well, the whole purpose of the Medicaid, of the Affordable Care Act, of Medicare, is to try to have a continuum of options for people, so that as they move up economic ladders, they pay more. So, a navigator you were probably talking to a broker at Blue Cross Blue Shield, not a navigator.
That would be an agent.
Yeah, or an agent, an agent. So unless you go on healthcare.gov and fill in the thing, if you are able to get some assistance, that's fine. And as you move up the economic ladder, you will pay more and more of the cost of your health care. That is the way it is. It is meant to be for those who need it, can get it, and those who can afford it and don't need it, they don't get it. What this is to try to make sure that we have a healthy America. What we know about people who don't have insurance is they don't go to the doctor, they use the emergency room for their health care, which is the most expensive place to get health care. And we also know that sick people are non-productive as employees, You go to work sick, you don't do the same sort of job you do. We need to get people health care. Children who are sick do not learn the same as others. We need to make healthcare affordable. I mean, I keep pushing, saying that I think one of the quality metrics for healthcare needs to be affordability. If people can't afford the product, then what good is it? You know, that's not getting a healthier America. And it's a public health issue. If we don't have access to health care and all of us working for a healthy America, you know, a pandemic goes through and it'll go through like, what's the thing that I want to say?
Butter.
Yeah, a knife through butter. That's a hot knife through butter. That's what happens. So the vision is a healthy America. And how do you get there? You know, if everybody had good jobs and that sort of thing, there would be few people on Medicaid, which is a good thing. You know, you know, what we need to work on is getting people health care, getting better jobs in America, and that's what it is. And that should be our vision. But what our vision should not be to deny people a need, which is health care, for the wrong reasons.
Now, speaking of Medicaid, can you tell me roughly, let's say family of 4, how much income has to be qualified for Medicaid?
I had that on here, so that was one of the very first ones that I did.
Yeah, just like
23,550.
Yeah, okay.
23? or
23,550.
Okay.
There it is. 133, yeah, it's 33,300 on here. You're doing Magi. Okay, you're doing Magi. Yeah.
Oh, yeah.
Okay.
Let's say someone lived in Michigan, they got their policy through, you know, the
Exchange.
exchange.
And they
And
moved.
then they moved to another state.
Then they would have to apply. They would have 3 months to apply for that state's exchange.
Okay. Are the different states?
The benefit packages are the same. Those are federal benefit packages that are on every exchange in America. Okay? Now, individual insurance companies may enrich those, and they may enrich them more and something. So you really do need to look at benefit packages. But the essential health benefits are in every package, and there will be differences in what the insurance companies in those states charge for some of those. It's just like I said, in states that didn't have a co-op, many of their policies are a lot more expensive on their exchange than in the states where there was a co-op insurance alternative, because of the competition of being concerned that the co-op would be very competitive.
I'm sorry. See, what it says there, 94,200 for family of 4, what is that about?
That is the 400% of poverty. That is the maximum income that a family can make and still get a 9.5% premium tax credit.
Okay.
Okay? It's the maximum for the premium tax credit. 250 is a premium tax credit and help with co-pays and deductibles. 133% is the maximum to be qualified for Medicaid. Okay? I hope it was helpful.
Very helpful.
Thank you.
Very nice. Thank you very much.
Oh,